Hello everybody, Dr. Vito Spadafino here, and today I want to speak with you about spinal degeneration. There's a number of words that are used to describe this. Some call it osteoarthritis, some call it DJD or degenerative joint arthritis. But what I want to talk about today is kind of your standard run-of-the-mill degenerative arthritis. There are different kinds. There's metabolic arthritis that has to do with how your body metabolizes different food chemicals. There's rheumatoid arthritis, which is an autoinflammatory, autoimmune type arthritis, but your run-of-the-mill arthritis will affect a lot of people. One misconception that a lot of patients will have is that they hear, oh, I have arthritis, almost like I caught a cold or I have high blood pressure or something like that. Like it's this disease that happens to them and they're not quite sure why. Maybe it's genetic, and there certainly can be, but more commonly what we see is that degenerative arthritis is something that you earn, right? It's something that we do or we get as a result of our lifestyle habits. So if you think about it, this is what a healthy joint looks like, okay? This is like a lumbar vertebra. What we want to see is a nice wide disc space there. We have nice smooth edges around the bones, okay? This is when a vertebra is aligned well and it's moving well. Our joints are designed to move. They don't have a ton of blood supply. The way they get their nutrients in and out is through movement, a process called imbibition. When we lack proper movement or alignment, what happens is over time, the disc will lose its fluid content, its pliability. The cartilage then, over time, if that isn't corrected, becomes more brittle, and your body will actually replace the cartilage with what's called an osteophyte. So we have all these little cells in the cartilage called chondrocytes, and you have chondroblasts, which are the cells that create more cartilage. Then you have chondroclasts, which take away the old cartilage and put new cartilage in, right? This is your body's way of responding to your demands. So if you're moving a lot, your chondroblasts are going to create more cartilage to replenish the old cartilage, get the old out, get the new in, keep you moving well, okay? The same is the concept for osteoblasts, which create bone, osteoclasts, which take away bone, okay? The way those cells work, basically it tells us that if you don't use it, you're going to lose it, okay? If you don't use your body in a weight-bearing manner, you're going to lose the integrity of your bone cells, and you get what? Osteoporosis. The same is the concept for our joints though too. So if we are not moving joints well, those chondrocytes will lose that function of replenishing cartilage, and we go through this degeneration process. Now, one thing that's important to realize is that this is not solely a product of how old you are. And the reason I can say that confidently is because time and time I'll have somebody, maybe they're in their 60s, maybe they're in their 80s, maybe they're in their 40s, and we see degeneration on their x-ray. I can point to a couple spots where the degeneration is particularly accelerated, but then there's other spots where their spine looks like it did when they were 20 years old. And the reason is not because certain bones are older or younger than the others, obviously they're all the same age, but it's because certain bones were exposed to undue stress while others were not, right? So that's really the key, is understanding where is there unhealthy stress to the joint, where is there a lack of proper alignment and motion. Where you have those things, that's when you're going to have the acceleration of this arthritis process. What is the antidote? The antidote is, first of all, correct the cause. So if you're not moving well, moving your spine through full healthy ranges of motion on a regular basis, if you don't have proper alignment, that's the first thing. The second thing is to create more stability around these bones so that they're protected from undue stress, okay? Then the other thing is looking at nutrition, because if you are a smoker, if you have a high inflammatory diet, these are things that will actually affect the microcirculation in the intervertebral disc. It will accelerate degenerative arthritis, things that we don't want. So you want to be eating healthy, anti-inflammatory, get rid of the smoking, give your body the healthy nutrients that it needs, and you'll be much better off. A couple supplements that I'll sometimes recommend are turmeric as an anti-inflammatory, and also glucosamine chondroitin sulfate is a good tool to give your body the building blocks it needs to replenish the cartilage, keeping your joints healthy. That doesn't only apply to your spine, but also extremity joints as well. So that's a little bit about degenerative arthritis. Again, it's important to realize that you can cause degenerative arthritis by what you do or don't do. So, by virtue of that, you can also help it to improve. Now, you can't reverse it, right? You can't go backwards, but certainly by getting the spine moving well and in better alignment, we can halt that process and help you get a lot of function back, decrease your pain, and that's a great thing for a lot of folks. So that's some information for you here today. I'm Dr. Vito Spadafino with West Suburban Wellness. Take care.